Today we're talking about the aging skin and some of the things that might come up as your skin is aging. I want you to take a look at the top layer of the skin. See that little divot right over here? Okay, that's what a wrinkle looks like on your skin. The epidermis is the top layer of the skin. Then we have the dermis, we have the fat right here, the little balls of yellow things, and then your muscle down here. A few things happen as we age. The epidermis changes. The dermis that holds a lot of the different organs that are found in the skin, as you see right over here. See these little guys right here? These are called sebaceous glands. Some people, depending if you have large pores and oily skin, usually the Mediterraneans, from Mediterranean, like Greece, Italy, kind of, they have a lot of olive oil, so they become super greasy. Oh, that's a joke. I hope you're laughing. Okay, well, I'm Greek, so I have large pores and oily skin. This way, I can be 55 years old and not have that many wrinkles. But my skin tends not to be as perfectly beautiful as, let's say, somebody from England or Ireland, where their skin is porcelain white and very smooth. You can't even see the pores. What happens here is that the sebaceous glands, which are right here, begin to get kind of inflamed, and they begin to push up towards the skin, giving you a white little bumpy area. Now, how can you avoid getting those? A lot of the times it's hereditary, so there's not much you can do. You can do treatments. You can do things like cryotherapy, where they go in and they freeze each little it looks like a little white pimple, but you can't squeeze anything out of it. Or you can burn it, but then you can have little scars, little brown spots. You can do what's called photodynamic therapy, where you put levulonic acid on your face, let it sit for 3 hours, and then use an IPL handpiece, oh my goodness, I can't even think. Like IPL, intense pulse light, on your skin to heat it up. And then, of course, you have to stay out of the sun for 48 hours, which is pretty tough. But that helps to smooth it out. You can do a CO2 laser, or you can do a Fraxel with a 1540, or a pulse dye laser. So those are more aggressive treatments. Or lately, they've done some research, and they said that if you can use some tretinoin cream, which is Retin A, and you can use that every night, or first every other night until your skin gets used to it, and then use it every night. It will help to kind of exfoliate the skin, turn it over, and hopefully subdue those little kind of little sebaceous glands. So I like the Obagi one because it has the least amount of ingredients. Recently, I purchased a Skin Medica. It's okay. I think I like the Obagi better. Anyways, but I'm not going to waste it. I'm certainly going to use it because it was kind of expensive, $125 for this. So pretty pricey. All right, the other thing that I do, because I'm 55, I have gone onto one of the websites and I've bought some progesterone cream. Now this is a bioidentical, meaning that, let me bring this closer to you. I got this from Dr. Bob Marshall, and he has a lab, and as you can see, you can order it yourself. I use this like on Monday nights. And then on Tuesday nights is a rejuvenation cream. This is colostrum. And as you see, it's from the same company. So on Mondays, I use my progesterone. On Tuesdays, I use my colostrum. And on Wednesdays, I use my Obagi or my Skin Medica retinol. Okay, hopefully my skin will stay as youthful as possible with the least amount of work. Let's talk about, tomorrow, let's talk about how after you have a knee arthroscopy, you have to be careful how the physical therapist is doing your therapy. I have a story to share with you, but I'll do that tomorrow. All right, see you then.